Good morning. It's time to get in touch. Brought to you by Geisinger Muncy and Jersey Shore. State-of-the-art healthcare close to home. Every week, this public affairs show shines a spotlight on people and programs in our communities that improve the quality of life in Lycoming County and beyond. I'm Freddi Hammer, host of In Touch and news director at Backyard Broadcasting. Today on In Touch, we're joined by Dr. Matthew Meissner, a board-certified urologist at Geisinger Muncy and Jersey Shore, and he's here to talk about a topic that affects millions of men worldwide, prostate cancer. Lots of questions about it recently with people in the news being diagnosed with that disease. Dr. Meissner will share his knowledge and help us better understand the risks, the screening options, the treatments, what men can do to protect their prostate health. And if you're a patient, a caregiver, or just want to be informed, this will help provide some valuable insight into one of the most common cancers among men. Hello, Dr. Meissner. Thanks for joining us today on In Touch.
Hi, Freddi. Happy to be here. Thank you for having me.
Absolutely. We're wondering about you and your background in urology. What got you started? I know you spent a lot of time in Texas.
I did, yes. So I'm one of those weird people who kind of always knew I wanted to be a urologist.
Okay.
In seriousness, it started in my second year of college. I did a research fellowship at MD Anderson as a college student, and I really fell in love with the surgery and the patients. And that was when I was 22 years old. And then 10 years later, I was a full-blown urologist. So I did my residency training, as you mentioned, in Dallas, Texas at UT Southwestern Medical Center. And then I did 2 extra years in cancer-specific urology, urologic oncology at MD Anderson Cancer Center in Houston.
So you have a lot of experience as far as knowing when you just look at the file, you can probably go right to the answers right there. I hope so for your patients.
Yes, for better or worse, I do know a lot about urologic cancers, but that's kind of what I've always wanted to do. Did
you have any family members that had been affected by prostate cancer?
No, I have not, thankfully. I actually have no prostate cancer in my family that I know of, but I was really inspired by 1 or 2 mentors in particular who took care of patients with prostate cancer, as well as other urologic cancers. So that's kind of what propelled me into this field.
Well, what exactly is prostate cancer? We've talked about it being common. Is that true for men?
It is, actually. It is the most common non-skin cancer in men in the United States.
Wow.
So there's about 300,000 cases diagnosed every year in the United States, with about 35,000 or so men dying of prostate cancer.
Oh, my goodness. My father did have surgery for it. It was benign, so at that time we just sort of did the treatment, and he was all right.
Well, thank God for that.
I wondered about risk factors. My dad was a pretty healthy man during his life, and so I was just wondering, is it about health, lifestyle? Is it just sort of genetics? What makes prostate cancer come about?
Well, one of the biggest risk factors for prostate cancer is being a man. And there's not a lot you can do to change that, right?
Right.
As I mentioned, it is the most common non-skin cancer in men in the United States, but there are some other things that put you at an increased risk for prostate cancer, and one of the most recognizable ones is going to be your family history, right?
Okay. Yes.
As you mentioned, your father had prostate cancer. So a lot of men have a family history of, quote, prostate issues. So that can be a lot of things. That can be a benign enlargement of the prostate, so not cancer, just a normal part of aging as the prostate grows as men age.
Okay.
And it grows faster and bigger in some men compared to others. But the thing you really want to pay attention to is if you have what we call first-degree relatives, so a father, a grandfather that had prostate cancer, and in particular, a prostate cancer that ended up spreading or ultimately killing them. Other things, there are certain genetic conditions. One of the more well-known ones, especially in the breast cancer world, is the BRCA2 or the BRCA mutations.
Okay.
Those actually can put men at an increased risk of early and more aggressive prostate cancer.
What is the overlap between urology and oncology in this place?
Well, that's a great question. So I am a urologic oncologist, so I do the surgical side.
Okay.
So the removal of the prostate, if you will, for prostate cancer. The oncology aspect is the medical treatment. So they typically focus on the patients where the cancer has spread, and they do a number of different interventions and drugs and things to treat the cancer when it has spread predominantly. Now, there is a lot of overlap between what I do and what they do, and there's also the radiation oncology people who help as well. So when we have a new patient who's diagnosed with prostate cancer, we really get all of our experts to give their opinion on what is the best course of action for this patient. Because, as I mentioned, prostate cancer is kind of it can be a heterogeneous, or there's many different stages and types, and not all of them are the same. So we try to get all of our experts to weigh in on all of our newly diagnosed prostate cancer patients.
You say that the different levels and there's different types. Is that more severe and less severe as you call them in different levels of prostate cancers?
Yeah, and so the technical term is going to be what we call the risk category.
Okay. So
there's different risk levels of prostate cancer, and this is a really important thing because, some cancers, you hear the word cancer and that's, people, their minds go all sorts of bad places, and in some cancers it's true, it's not a good cancer to have, but with prostate cancer, we like to categorize patients into either having a low risk, an intermediate, or a high risk prostate cancer. And the names are a little self-explanatory, but I'll go into it a little bit more if that's okay. So the low risk prostate cancer, yes, we call it cancer, but by definition, it has a low risk of spreading and it has a low risk of actually threatening your life.
Okay.
And these are cancers that we can actually watch. And I know it sounds weird, and you should see the look on some of my men, their faces when I tell them we're just going to watch this. They kind of raise their eyebrows. You're going to watch a cancer. Well, the answer is yes. And the reason we do that is because we know it poses almost no risk to their life if it's low risk. And the intervention, so particularly surgery and radiation, to cure it, they have pretty life-altering side effects, which we can go into a little bit later. And then you have your middle level. So you're in between prostate cancers, the intermediate risks. And some of those guys, yeah, you need to address it. And some of them you can actually still watch. And that's kind of a very nuanced discussion between myself and the patient. And then finally, you have the high-risk prostate cancers. And these are the guys that you want to treat early. If you can, remove the prostate or do radiation to kill the cancer so that you prevent it from spreading. Because, again, by definition, these cancers are at a higher risk of spreading, at which point they're essentially not curable.
Okay. What age of men are you seeing for screening? Would you see something more severe in a younger man?
That's a good question. So the typical guideline, or our guideline right now, says that screening should start around the age of 50 for men who are of average risk of developing prostate cancer.
Okay.
So, and that's generally just a PSA test. It's just a blood test. And the PSA level, if it's elevated, can indicate a potential prostate cancer, although there are many causes for an elevated PSA level. It's not just prostate cancer. Mm-hmm. I like to explain it to my patients, if your cholesterol goes up, it's because your diet is not very good, right?
Right.
And if you change your diet, you eat some more healthy whole foods, fruits, vegetables, your cholesterol will go down, or you take a medication, your cholesterol will go down. The PSA isn't necessarily like that. If your PSA is going up, mm-hmm. It's not necessarily because you have prostate cancer. There could be a number of other things going on.
Okay.
The first level checking is just a PSA blood test.
Okay.
So men who are at higher risk, so like I mentioned, the guys with a strong family history or the genetic conditions that predispose them to having a more aggressive prostate cancer, they can actually start closer to age of 40.
Okay.
And it's important also, men of African-American ancestry should also be considered to be screened earlier because we know that those men actually have a higher risk of dying from prostate cancer than other races.
Oh, my gosh. Okay. You have a lot of research to this. Is there a lot of research in prostate cancer from the past few years that have given you a lot of this information, or do you look forward to more research in the future?
Oh, yeah. There's been a ton of research, particularly on the kind of the extremes. So the low-risk prostate cancer, which I talked about, and that research has really just centered around proving that it's safe to do, that you can just watch these guys. And if it gets worse over the course of watching them, say 5 years, 10 years, whatever, and they need surgery or radiation at that point, their chance of cure is still excellent.
Sure.
And then at the other extreme, there has been a ton of research and tons of new drug development for the guys where the cancer has spread. And so we've gotten to the point now where even when the cancer has spread, we don't technically have a cure yet. But the number of treatments that we have become so effective that we can keep guys alive for 10 to 15 years, even longer sometimes with these new treatments. It is good news, and it has really changed how we view the management of prostate cancer across all stages.
What do men do when they make an appointment? Are they nervous? What kind of experience does a man have when he comes to an appointment for urology?
Yeah, so there's a fair amount of anxiety surrounding the elevated PSA levels, right?
Yeah.
You get this test and you get the result that comes back. If you check your results in your Geisinger or your family doctor tells you it comes back, it's red, your PSA is high, and your mind again goes all sorts of bad places.
Sure.
So my job when I see these patients is to try to reassure them. And I basically have the discussion that we had, not really even mentioning, that you could have cancer right up at front. I tell them again, There's a lot of reasons for the PSA to go up. So one of the first things we actually do, if they've only had one PSA level, we have a discussion. We usually just repeat the test a couple weeks later just to make sure it wasn't an outlier or an error. And then if that remains elevated, then we have to get into a discussion about potentially doing a biopsy or something like that.
Okay. That's probably a little nerve-wracking, too, for some folks.
Yes, it is. The discussions around the biopsies are always nerve-wracking, and rightfully so. I mean, I always tell my patients, no one really enjoys the procedure.
Sure.
It doesn't take more than 10 minutes, but it's not a lot of fun to go through. Fortunately, at Geisinger, we have a number of different ways that we can do the procedure. We can do it a traditional way where we actually have to go through the rectum, or we can do it another way where we actually go through a place called the perineum, which is in between, the rectum and the male genitals, and we can actually go through the skin there. I've been doing that for about 2 years here, and men find it a lot more comfortable than the other way.
You work at Geisinger Jersey Shore in the system throughout Geisinger, so you're able to take new patients, people that have questions about urology. What's going on in their lives that they think, maybe I should see a doctor? What kind of symptoms are they going through?
Most prostate cancers are found just by having your PSA checked.
Okay.
And again, that's a discussion to have with your primary doctor. Should I have this test? What are the implications of a positive test? What's going to happen next? And so we try to do a lot of outreach with the primary care doctors to explain to them, what the next steps are when the patients come to urology, like we were talking about. Mm-hmm. But when you have symptoms of prostate cancer, so the symptoms of prostate cancer are very similar to the symptoms of the much, much more common thing called BPH, or benign prostatic hyperplasia, which happens in a lot of aging men.
Okay.
So going to the bathroom more frequently, struggling to empty your bladder, your stream getting weaker. Pain is rare. Blood in the urine, if you're seeing blood when you urinate, absolutely need to see a urologist. Things like weight loss, pain in your back, your leg, your arm, like new severe pain, mm-hmm. Those would be more concerning for a more advanced prostate cancer if you have a diagnosis. But I think really, Freddi, the important thing to know is that if you're having a little trouble urinating and you're getting up there in age, over 65, it's probably not prostate cancer, but it should certainly be discussed with your doctor about doing a PSA.
Is that on the protocol of a family doctor to ask as far as an aging man? They know these are the questions to ask at this appointment?
Absolutely. And, most men, if they're having symptoms that are bothersome enough, they will tell their doctor.
Okay, yes.
As you can imagine, if you're having trouble peeing, it's not a fun way to live.
Definitely tell somebody, for sure. You were talking about the treatment and how there can be some side effects on that and what they go through as far as once there is treatment and you go that way. What kind of medications would there be, or what kind of lifestyle changes would one make to be after treatment or during treatment?
That's kind of the main discussion we have with patients when we're deciding on what's going to be the best way to treat their prostate cancer. If after discussion with me and the other team members, if we feel like it needs to be treated, the main discussion centers around the side effects. So unfortunately, the prostate kind of sits at the very bottom of the male pelvis. Okay. So it's underneath the bladder, and it's in between the bladder and the urethra. And so it's important in male sexual and urinary function. So the side effects of surgery and radiation have sometimes some pretty life-altering effects on the male sexual and urinary function, particularly things like erectile dysfunction mm-hmm. and urinary incontinence, or difficulty controlling your urine. Now, the severity of these side effects is different between surgery and radiation, and that's one of the points that we discuss. But to address them after surgery or radiation, there's a number of things we can do, including physical therapy. There's oral medications to help with some of the sexual side effects. And then down the road, if ultimately the patients aren't satisfied with their degree of healing, we even have things like prosthetics that can really be life-changing for certain guys who their bodies just don't heal naturally after the surgery or the radiation.
I see. Are these part of the misconceptions as far as when people are going through this procedure, they think, oh, I'm going to be ruined for life? That probably is one of the biggest misconceptions.
Yeah, it is a big concern among all guys undergoing this, and it seems to be pretty well permeated in the general public, the side effects of surgery and radiation. A short way to answer your question is no, they're not going to be ruined for life.
Okay, good.
Most men have a good, or what we would call, from their perspective, a satisfactory recovery for those functions. Okay. But there are men who just don't get better, and we have to do some of those other things that I just talked about to fix it. And again, this is why we don't recommend treatment for every single prostate cancer that we see. because these side effects can be life-altering, and sometimes they don't get better. And if we aren't doing a procedure or performing radiation with an intent to cure a cancer that could potentially kill somebody, we don't want to subject them to these side effects.
Well, that's good. I mean, you're talking about men who are coming in for screenings. Do you find that they are anxious, or is there anything that you would say to a person with anxiety about coming in?
Well, I would encourage them, if they're thinking about getting a PSA test, and this is part of our guidelines, is that they've got to engage in what's called shared decision-making with their primary doctor or their healthcare provider who they trust. You don't have to be screened for prostate cancer, especially if you're average risk, no family history, none of those genetic things that we talked about. You don't have to be screened, but it's important to understand the risks and benefits of not doing the screening and doing the screening.
Okay.
So I think having a good understanding of what the PSA test is and what the next steps would be is the first aspect of doing the PSA test and discussing it with your primary doctor.
Okay. Well, what kind of resources are available? If people are going through this at any level, I'm sure that there are resources that Geisinger provides for patients going through this.
Yeah, absolutely. So our urology department, usually once or twice a year, will do doc talks on prostate cancer. And these are forums where I have participated in some. We have some of our other urologists who treat prostate cancer. They participate. They can actually send in questions, and we answer them in sort of a live setting, which is very helpful. There's also a number of online blogs. I think there was recently an article on prostate cancer after the former president was diagnosed that we put out.
Sure.
Kind of talking about some of the things that we talked about. And then I think your best resource, honestly, is going to be your well-informed, knowledgeable Geisinger physicians and advanced practice providers, especially in the urology department. We have a ton of expertise, a ton of experience dealing with this. So any questions, concerns about PSAs, prostate cancer, we're happy to address.
I guess there were lots of questions once former President Biden was diagnosed, lots of people calling and asking and maybe getting those life-saving treatment.
I'm sure, yes. After the former president was diagnosed, I got a lot of questions myself from my patients.
So grateful for your expertise and helping out those who may need that. I guess we can call for an appointment and get the process started if they're concerned about their health.
Sure, Freddie. And you mentioned Jersey Shore. So we actually are out there once a month. We actually will perform biopsies if needed out there. We also have physicians out there to talk about elevated PSA. If you end up having one, we can certainly see you out at Jersey Shore and get you taken care of with the right person.
Well, perfect. We will certainly get people connected with Geisinger, Muncy, and Jersey Shore to talk about prostate cancer if it's on their mind and be able to get with your team. Thank you so much, Dr. Meissner, for being on In Touch today, talking about prostate health. We appreciate your expertise with Geisinger, Muncy, and Jersey Shore.
It was a pleasure, Freddie. Thank you very much.
In Touch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us for questions, comments, or topic ideas, call weekdays 570-323-8200 or email me at fhammer@backyardbroadcasting.com. For archived files of our In Touch shows, find our Backyard Podcasting link on any Backyard Broadcasting website or subscribe to our YouTube channel, Backyard Broadcasting. The programming discussed here on In Touch does not necessarily reflect the feelings or opinions of the management or staff. Thanks for listening to In Touch. Brought to you by Geisinger, Muncy, and Jersey Shore. State-of-the-art healthcare close to home.